Best CEN Test Prep App. Question 1. In a patient with suspected acute coronary syndrome, which of the following is the priority nursing action upon arrival? Option A. Obtain 12-lead ECG within 10 minutes. Option B. Start 2 large-bore 4 lines. Option C. Administer chewable aspirin. Option D. Draw cardiac enzymes. The correct answer is option A. Obtain 12-lead ECG within 10 minutes. The priority for suspected acute coronary syndrome is a 12-lead ECG obtained within 10 minutes of arrival. Rapid identification of STEMI allows for timely reperfusion therapy. While aspirin, C, should be given promptly, the ECG is the priority for diagnosis. For access, B, and lab draw, D, are important but follow the ECG. Question 2. A patient's ABG results show pH 7.25, PaCO 255 mmHg, HCO 324 milliequivalent/L. What is the most likely interpretation? Option A. Metabolic acidosis. Option B. Metabolic alkalosis. Option C. Respiratory acidosis. Option D. Respiratory alkalosis. The correct answer is option C. Respiratory acidosis. The ABG shows a low pH, acidemia, elevated PaCO 2, greater than 45 mmHg, and normal HCO3. This is consistent with acute respiratory acidosis from hypoventilation. Metabolic acidosis, A, would show a low HCO3. Metabolic alkalosis, B, would show elevated pH and HCO3. Respiratory alkalosis, D, would show low PaCO 2. Question 3. A patient is brought to the ED after a witnessed seizure lasting 8 minutes. What is the priority nursing action? Option A. Administer 4-lorazepam. Option B. Assess for head injury. Option C. Obtain a stat CT scan. Option D. Perform a detailed neurological assessment. The correct answer is option A. Administer 4-lorazepam. A seizure lasting more than 5 minutes is status epilepticus, a neurologic emergency. The priority is to terminate the seizure with benzodiazepines, lorazepam or diazepam. While head injury assessment, B, and CT, C, are important, the seizure must be stopped first. A full neuro assessment, D, will be performed after the seizure terminates.
Stressed about your property and casualty exam? We can take property and casualty exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done.
Question 4. A patient with a known history of diverticulitis presents with fever and severe left lower quadrant pain. Which assessment finding is most concerning? Option A. Abdominal guarding. Option B. Rebound tenderness. Option C. Rigid, board-like abdomen. Option D. A flatulence. The correct answer is option C. Rigid, board-like abdomen. A rigid, board-like abdomen in a patient with diverticulitis suggests perforation with peritonitis, a surgical emergency. Abdominal guarding, A, and rebound tenderness, B, are also signs of peritoneal irritation but are less severe than board-like rigidity. Flatulence, D, is not concerning. Question 5. A patient with acute ischemic stroke arrives at the ED 2 hours after symptom onset. Which question is most important for determining eligibility for thrombolytic therapy? Option A. What is the patient's blood pressure? Option B. What time were the patient's symptoms last known to be normal? Option C. Does the patient have a history of hypertension? Option D. What is the patient's family history? The correct answer is option B. What time were the patient's symptoms last known to be normal? The time of last known normal is the most critical factor for determining eligibility for thrombolytic therapy with TPA. The window is up to 4.5 hours for select patients. Blood pressure, A, is also important but the time window is the primary determinant. History of hypertension, C, is relevant but not as critical. Question 6. A patient with severe asthma exacerbation has a peak expiratory flow rate, PEFR, of 35% of personal best. Which treatment should the nurse anticipate? Option A. Continuous nebulized albuterol. Option B, oral corticosteroids. Option C, 4-magnesium sulfate. Option D, immediate intubation. The correct answer is option A, continuous nebulized albuterol. PEFR below 50% indicates a severe exacerbation requiring aggressive bronchodilation. Continuous nebulized albuterol is indicated for severe asthma. Oral corticosteroids, B, should also be given but are not the immediate treatment. 4-magnesium, C, may be used for refractory cases. Intubation, D, is for impending respiratory failure with altered mental status, exhaustion, or hypercapnia. Question 7. A patient is scheduled for an abdominal CT with oral contrast. Which finding in the patient's history may require special preparation or alternative imaging? Option A, diabetes mellitus. Option B, hypertension. Option C, allergy to shellfish or iodine contrast. Option D, asthma. The correct answer is option C, allergy to shellfish or iodine contrast. Allergy to shellfish or iodine contrast is a concern due to cross-reactivity with 4 contrast agents. Pre-medication with steroids and antihistamines may be needed. Diabetes, A, and hypertension, B, are less significant. Asthma, D, is relevant but less directly impactful. Question 8. A patient presents with abdominal pain, vomiting, and a blue-gray discoloration of the gums. What heavy metal poisoning is most likely? Option A, mercury. Option B, arsenic. Option C, lead. Option D, iron. The correct answer is option C, lead. Lead poisoning can cause abdominal pain, lead colic, vomiting, and the classic blue-gray lead line at the gingival margin. Mercury, A, causes neurological symptoms. Arsenic, B, causes garlic odor and GI symptoms. Iron, D, causes GI symptoms and metabolic acidosis but not gingival discoloration.
Are you looking for property and casualty exam actual questions? Visit our website pokerexams.com to access property and casualty exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get property and casualty exam answer key today.
Question 9. A patient presents following a motor vehicle crash with hoarseness, marked left lateral neck swelling, and respiratory difficulty. The priority intervention for this patient is? Option A, tracheal intubation. Option B, 4 fluids. Option C, needle cricothyrotomy. Option D, pleural decompression. The correct answer is option C, needle cricothyrotomy. This patient has signs of impending airway obstruction from a laryngeal or tracheal injury, hoarseness, neck swelling, and respiratory distress. The swollen and distorted anatomy makes oral or nasal intubation, A, likely to be impossible or dangerous. Needle cricothyrotomy, C, provides immediate airway access below the injury. 4 fluids, B, and pleural decompression, D, are not the priority for airway compromise. Question 10. A patient presents with sudden onset of sharp chest pain and dyspnea following a long flight. What is the most likely diagnosis? Option A, spontaneous pneumothorax. Option B, pulmonary embolism. Option C, acute coronary syndrome. Option D, pericarditis. The correct answer is option B, pulmonary embolism. This patient has risk factors, prolonged immobility from a long flight, and classic symptoms of pulmonary embolism, sudden dyspnea and pleuritic chest pain. While spontaneous pneumothorax, A, can cause similar symptoms, the history of prolonged travel makes PE more likely. ACS, C, presents with chest pressure with radiation. Pericarditis, D, pain is positional. Question 11. A patient has a Glasgow Coma Scale, GCS, score of 7. What does this indicate? Option A. The patient is neurologically intact. Option B. The patient has a moderate brain injury. Option C. The patient has a severe brain injury. Option D. The patient is brain dead. The correct answer is option C. The patient has a severe brain injury. GCS scores are interpreted as 13-15 mild brain injury, 9-12 moderate brain injury, and 3-8 severe brain injury. A score of 7 indicates severe brain injury requiring intubation and ICU care. This patient is not intact, A, does not have moderate injury, B, and is not brain dead, D. Question 12. A patient with increased intracranial pressure is at risk for Cushing's triad. Which of the following comprises Cushing's triad? Option A, hypertension, bradycardia, irregular respirations. Option B, hypotension, tachycardia, tachypnea. Option C, hypertension, tachycardia, Cheyne-Stokes respirations. Option D, hypotension, bradycardia, hypoventilation. The correct answer is option A, hypertension, bradycardia, irregular respirations. Cushing's triad is a late sign of increased ICP, indicating herniation is imminent. It consists of hypertension, widening pulse pressure, bradycardia, and irregular respirations. This compensatory response is the body's attempt to maintain cerebral perfusion. Question 13. A patient is receiving packed red blood cells. 15 minutes into the transfusion, the patient reports chills, flank pain, and shortness of breath. What is the nurse's priority action? Option A, slow the infusion rate. Option B, stop the transfusion immediately. Option C, administer diphenhydramine. Option D, notify the provider. The correct answer is option B, stop the transfusion immediately. This patient is experiencing signs of a possible transfusion reaction, chills, flank pain, dyspnea. The immediate priority is to stop the transfusion, keep the 4-line open with normal saline, and notify the provider. Slowing the infusion, A, does not stop the reaction. Diphenhydramine, C, may be given but after stopping the transfusion. Question 14. In triaging a patient with abdominal pain and a fever of 102 degrees Fahrenheit, the nurse should assign which triage category based on the Emergency Severity Index, ESI. Option A, ESI 1. Option B, ESI 2. Option C, ESI 3. Option D, ESI 4. The correct answer is option B, ESI 2. ESI 2 is for high-risk patients who are not in immediate danger but require rapid assessment and treatment. A patient with fever, 102 degrees Fahrenheit, and abdominal pain meets criteria for ESI 2, high-risk. ESI 1A is for life-threatening conditions requiring immediate intervention. ESI 3C is for stable patients requiring 1-2 resources. ESI 4D is for stable patients requiring no resources. Question 15. The nurse is caring for a patient in cardiogenic shock following an ME. Which hemodynamic parameter is expected? Option A, elevated CVP, elevated PCWP, low cardiac output. Option B, low CVP, low PCWP, high cardiac output. Option C, elevated CVP, low PCWP, high cardiac output. Option D, low CVP, elevated PCWP, low cardiac output. The correct answer is option A, elevated CVP, elevated PCWP, low cardiac output. Cardiogenic shock is characterized by pump failure, leading to elevated filling pressures, CVP and PCWP, and reduced cardiac output. Options B and C describe distributive shock, such as sepsis or neurogenic shock. Option D is not consistent with any shock pattern. Question 16. Which of the following ECG findings is most consistent with pericarditis? Option A, ST-segment elevation in all leads with reciprocal depression. Option B, diffuse ST-segment elevation with PR-segment depression. Option C, ST-segment elevation in contiguous leads with reciprocal changes. Option D, pathologic Q waves in leads 2, 3, and AVF. The correct answer is option B, diffuse ST-segment elevation with PR-segment depression. Acute pericarditis classically presents with diffuse, global, ST-segment elevation across most leads along with PR-segment depression. The ST-segment elevation is concave upward and does not have reciprocal changes. Option A describes STEMI, which typically shows ST elevation in contiguous leads with reciprocal depression. Option C also describes STEMI. Option D describes a prior inferior wall ME. Question 17. A patient presents with acute kidney injury. Which laboratory finding is most consistent with prerenal azotemia? Option A, BUN/CR ratio 20:1. Option B, BUN/CR ratio 10:1. Option C, normal BUN/CR ratio. Option D, elevated CR with normal BUN. The correct answer is option A, BUN/CR ratio 20:1. In prerenal azotemia, decreased renal perfusion, the BUN/CR ratio is typically 20:1 due to increased reabsorption of urea. In intrinsic renal disease, the ratio is typically 10:1. B. Normal ratio, C, and elevated CR only, D, are not characteristic of prerenal azotemia. Question 18. A patient has been exposed to cyanide. What is the most characteristic finding? Option A, cherry-red skin. Option B, cyanosis. Option C, slate-gray skin. Option D, flushing. The correct answer is option A, cherry-red skin. Cyanide poisoning causes a classic cherry-red skin color due to high venous oxygen saturation from impaired cellular oxygen utilization. Cyanosis, B, is seen in hypoxia from other causes. Slate-gray skin, C, is seen in methemoglobinemia. Flushing, D, is nonspecific. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient who has ingested a large amount of acetaminophen is at risk for? Option A, acute kidney injury. Option B, hepatic necrosis. Option C, pulmonary fibrosis. Option D, cardiomyopathy. The correct answer is option B, hepatic necrosis. Acetaminophen toxicity causes hepatic necrosis due to accumulation of the toxic metabolite NAPCI, which depletes glutathione and damages hepatocytes. Acute kidney injury, A, can also occur but is secondary. Pulmonary fibrosis, C, and cardiomyopathy, D, are not associated with acetaminophen toxicity. Question 20. A patient at 34 weeks gestation presents with vaginal bleeding and abdominal pain. What is the priority nursing action? Option A, assess fetal heart rate. Option B, obtain maternal vital signs. Option C, prepare for emergency delivery. Option D, perform a pelvic examination. The correct answer is option B, obtain maternal vital signs. The ABCs and maternal stabilization are the priority. Vaginal bleeding in the third trimester may be from placental abruption or placenta previa. Maternal vital signs indicate hemodynamic stability. Fetal heart rate, A, is important but secondary to maternal status. Pelvic exam, D, is contraindicated until placenta previa is ruled out. Question 21. A patient presents with acute onset of severe, tearing chest pain radiating to the back. Blood pressure is 160/90 mmHg in the right arm and 110/70 mmHg in the left arm. What is the priority nursing intervention? Option A, administer 4 morphine for pain. Option B, obtain a 12-lead ECG. Option C, administer 4 beta- blockers to reduce heart rate and blood pressure. Option D, prepare for stat CT angiography. The correct answer is option C, administer 4 beta- blockers to reduce heart rate and blood pressure. This patient's presentation, tearing chest pain radiating to the back with unequal blood pressures, is classic for acute aortic dissection. The priority medical intervention is rapid reduction of heart rate and blood pressure to decrease aortic wall stress and prevent propagation of the dissection. Beta- blockers, example esmolol, are the first line agents. While pain management, A, is important, it is secondary to hemodynamic control. ECG, B, is appropriate but does not address the life-threatening process. CT angiography, D, is diagnostic but is performed after stabilization. Question 22. A patient is diagnosed with acute appendicitis. The nurse is particularly concerned if the patient reports which symptom. Option A, sudden relief of pain. Option B, nausea and vomiting. Option C, right lower quadrant pain. Option D, rebound tenderness. The correct answer is option A, Sudden relief of pain. Sudden relief of pain in a patient with suspected appendicitis may indicate perforation of the appendix. This is a serious complication requiring immediate surgical intervention. Nausea and vomiting, B, right lower quadrant pain, C, and rebound tenderness, D, are all expected findings in appendicitis. Question 23. Which of the following is a true statement about do minus not minus resuscitate, DNR, orders? Option A. A DNR order indicates no further care should be given. Option B. A DNR order is a standing order for all patients. Option C. A DNR order is written by a physician after discussion with the patient or family. Option D. A DNR order can be written only by the patient's family. The correct answer is option C. A DNR order is written by a physician after discussion with the patient or family. DNR orders are written by a physician after discussion with the patient or healthcare proxy. DNR does not mean no care, A. It means no CPR. DNR is not a standing order, B. Family, D. Cannot write the order but can participate in discussion. Question 24. Which finding in a patient with pneumonia would indicate the need for ICU admission? Option A. Respiratory rate of 24 breaths/min. Option B. Altered mental status. Option C. Temperature of 101.5 degrees Fahrenheit. Option D. WBC count of 15,000. The correct answer is option B. Altered mental status. Altered mental status in a patient with pneumonia indicates severe illness, possible sepsis, or hypoxemia, and warrants ICU-level care. A respiratory rate of 24, A, is mildly elevated and can be managed on a medical floor. Temperature of 101.5 degrees Fahrenheit, C, is common with pneumonia. WBC of 15,000, D, is elevated but not indicative of ICU need by itself. Question 25. A patient with a diagnosis of bipolar disorder is brought in for mania. Which of the following is a priority nursing intervention? Option A. Administer lithium immediately. Option B. Ensure the patient is in a safe, calm environment. Option C. Restrict fluid intake to prevent water intoxication. Option D. Place the patient in seclusion. The correct answer is option B. Ensure the patient is in a safe, calm environment. Safety is the priority. A calm, safe environment with decreased stimulation can help manage manic behavior. Lithium, A, may be prescribed but administration is a provider order. Fluid intake, C, should be monitored but lithium requires adequate fluid intake. Seclusion, D, is only for imminent danger.